Let's call the Shadow Secretary of State, Wes Streeting.
Can I thank you, Mr Speaker, for granting this urgent question to ask the Secretary of State for Health and Social Care if he will make a statement on the NHS strikes.
Minister.
Well, thank you, Mr Speaker, and I'm grateful to the honourable member for his question, which I'm taking on behalf of the Department as the Secretary of State is attending a COBRA meeting which is focused on minimising the disruption experienced by patients because of today's walkouts. In preparation for today's industrial action, we have again drawn on extra support from a range of places, including military service personnel, volunteers and the private sector. People should continue to use NHS 111 if they need medical help and dial 999 in the event of an emergency. Yet, Mr Speaker, even with such strong contingencies in place, including more people trained to drive ambulances and doctors redeployed to other parts of the system, it is no replacement for having the right people doing the right jobs. And any strike inevitably means that some patients will have their treatment delayed, and I know that people are being contacted if their appointments need changing. Around 88,000 procedures or outpatient appointments have been postponed as a result of industrial action over the last 8 weeks. So I'm disappointed and concerned that patients are facing disruption once again, especially, Mr Speaker, because strikes by RCN members have now come together with action by GMB and Unite members in 8 ambulance trusts. Mr Speaker, I recognise that there have been efforts on behalf of unions to ensure derogations are in place to keep people safe, and acknowledge that some aspects of this can indeed be challenging. But it's essential that all unions adhere to a set of derogations at a national level so that we can plan and act with certainty. I've also been heartened to hear that on previous strike days, some devoted ambulance workers and nurses who received calls whilst on the picket line returned to work where derogations were not going to be met. This is a real tribute to the care and dedication that we see on the front line day in, day out. But ultimately, both they and the public should no longer be in this situation, because we all know that industrial action is in nobody's best interest, especially given the collective challenges we face to help the NHS recover from the pandemic. And despite what the honourable gentleman opposite might imply, there is much common ground, not least our shared desire to improve the NHS and deliver better care. Mr Speaker, last week we announced our plan to recover urgent and emergency care, the second of 3 plans to cut waiting times in the NHS, including our elective recovery plan and our primary care recovery plan, which will be published in the next few weeks. With such important missions ahead of us and fewer than 2 months left of this financial year, it is time to move forward and look ahead and come together in the interests of the patients that we all serve.
Meeting.
Thank you, Mr Speaker. This week will see the biggest strike in the history of the NHS. Right. Nurses, ambulance workers and physiotherapists all driven to walk out. 88,000 appointments, including 10,000 operations, have already been cancelled, with much more disruption to patients expected this week. Yet government ministers still speak as if they're mere observers or commentators, not leaders or key to solving this dispute. This is the cost of the Prime Minister's failure to sit down and negotiate with nurses, paramedics and other NHS staff. Let us be clear about this fact. There has not been a single minute of negotiation on pay. NHS leaders are asking the government to negotiate. Chief nurses are desperate for the government to negotiate. The unions have offered to call off the strikes if the government is willing to negotiate. The public cannot understand why even now they won't get around the table and sort this out. So what on earth are they playing at? Developments in Wales show there is a deal to be done. The General Secretary of the RCN has written to the Prime Minister, but she has not heard anything from the government for weeks. It looks to the country like the Prime Minister and the Health Secretary are the ones on strike. Where is the Prime Minister? Where is the Health Secretary? In the week of the biggest strikes in the history of the NHS, during the biggest crisis the NHS has ever faced, the Health Secretary wasn't available for interviews this morning, he's not available to MPs today, and we're meant to believe that at 4 o'clock in the afternoon he's talking about how to avert disruption that's been taking place all day. Don't make me laugh. Perhaps the Health Secretary is busy briefing against the Chancellor, just as the Chancellor is busy briefing against him. All the while, the Prime Minister is too weak to do anything about it. The power to stop these strikes is in the government's hands. Patients have suffered enough disruption as it is. Isn't it the time the Prime Minister swallows his pride, sits down with NHS staff and negotiates an end to these strikes by paying NHS staff fairly?
Minister.
Well, Mr Speaker, what I'm not going to engage in is the playing of party politics on this. The honourable gentleman already knows. The honourable gentleman already knows that the Secretary of State is due to attend a COBRA meeting, which he and I rotate. And the honourable gentleman may have missed it. He may have missed it, Mr Speaker. He may have missed it. This morning he did do a media clip, and you will have seen that across. You will have seen that across multiple outlets. But, Mr Speaker, where I do agree with my honourable friend, he is right to talk about the amazing job that our NHS colleagues do on the front line. I know he does that, and I thank him for that. But it's even more reason why we must find a fair resolution. And, Mr Speaker, they certainly won't get one from the benches opposite. They say that they back the independent pay review process, whilst disagreeing with their decision when it doesn't suit them. They say they would not increase public spending, whilst failing to set out any plans for how they might pay for unaffordable pay increases. They say they believe in public safety too, whilst criticising the common sense steps we're taking to ensure safe minimum staffing levels, just as they do in many other European countries. We've got a plan, Mr Speaker. They do not. Over 1 million NHS staff have been given at least a £1,400 increase in their pay, representing a 9.3% rise for those on the lowest salaries. Last year, NHS staff also received a 3% pay rise, even when pay was frozen across the rest of the public sector. And we've done this, Mr Speaker, because we know how hard NHS colleagues work, and we recognise that there are cost of living pressures on NHS staff. Now, our goal has always been for a resolution that is fair for colleagues and fair for the country, to find a way forward that ensures that we're spending money where it's needed most, helping the NHS recover from the pandemic, and not on pay hikes that would stoke the inflation and ultimately, Mr Speaker, make us all poorer. Now, I met with GMB members last week, and together with my ministerial colleagues, I remain fully committed to working together with the unions, the NHS and others to find a responsible and a fair way forward.